In medicine, as we know, there is nothing more dangerous than someone who is confidently wrong. With some of the early AI chatbots, when you'd ask a medical question, you'd often get a confidently wrong answer. Now, to be fair, the new generation of clinical AI tools, they aren't just hallucinating wild treatment plans like some of the early chatbots did. Today's more enterprise AIs are actually grounded in incredibly reliable, peer-reviewed medical data sets. Yes, it's helpful and interesting to have all that information at your fingertips. But the reality of clinical practice is having the data at your fingertips is only half the battle. The other half is trust and experience. We have to trust that the recommendation is safe for our patients. When faced with a complex case, we don't just run a glorified PubMed search. Our default is to consult a colleague or ask a mentor that we trust, someone who has additional expertise in the problem that we're trying to solve. Because that's how we were trained. We use the literature as a baseline, but professional experience carries more weight in our decision-making process. Today, we're evaluating a tool that's attempting to bridge that exact gap. We're going to look at how Dox AI is helping human oversight make a comeback in healthcare tech, and how combining AI speed with verified peer-to-peer confirmation might finally give us the trust needed to use these tools on the floor. So let's go. Hi everyone, welcome back to SpeakMD. I'm Dr. AJ Balleram. I'm a full-time practicing orthopedic surgeon, and on this channel we review the technology that is reshaping how physicians practice medicine. Today, we're doing a review on Doximity's AI platform, as well as a short tutorial on the peer check system and the expert commentary features that I think have the chance to fundamentally change the game for clinical AI. So before we get into it, just in full disclosure, I was cordially invited to Doximity's AI Summit for physician advisors. I was able to meet some great physicians doing really awesome things both inside and outside of medicine. An honorarium was offered, but given my role in this channel evaluating products, I politely declined that. That said, I appreciate that compensation for physicians' time was provided. If you stick around, you're going to see how through this platform, you could be compensated for peer review in your area expertise as well. Now, to set the stage, let me walk you through the three competing philosophies that I'm seeing in clinical AI right now, because that'll help you understand where Doximity is doing something a little bit different. So on one end of the spectrum, you have apps like Open Evidence. It's a pure retrieval generation model that grounds every response in peer-reviewed literature from over 60 million papers. It's using the studies cited in reputable medical journals to respond to the clinical question. And then, of course, there's the question of trusting the output. Like all AI interfaces, there can be hallucinations, and in that situation, the information provided could be erroneous. So on one hand, we have this amazing clinical tool with infinite information, but no human oversight over the answers. And on the opposite end, you have UpToDate, the gold standard for 30 plus years. Over 7,500 expert editors, unmatched editorial review. Their new expert AI tool wraps generative AI around their closed body of content, so there is less risk of internet hallucinations. The trade-off for that is speed and accessibility. Individual subscriptions for UpToDate can run over $500 a year. There's also an inherent lag in incorporating the absolute latest clinical trials because everything does have to go through that massive centralized editorial process before it gets published. And then there's Doximity occupying kind of the strategic middle ground. What Doximity has built with Dox AI is a tool attempting to get the best of both worlds. You still get the rapid, comprehensive AI synthesis of newer studies. That's the speed that Open Evidence delivers. But then you layer on top of that a human physician verification system, the trust that UpToDate's editorial model provides. So when thinking of something comparable, I was thinking of an example, and my kids, for some reason, love Beat Bobby Flay on the Food Network right now. And what I was thinking is, if you could ask ChatGPT, let's say, for Bobby Flay's barbecue ribs recipe, and it would give you back an answer. You would read that answer and read the recipe and understand that it's probably pulling this information from the internet. We don't know if exactly right. We don't know what Bobby's tips and tricks are or if he has any nuance to this specific recipe. But what if when you asked for his recipe, it actually pinged him and said, hey, this is what I'm going to respond to this person. Do you have any additions or any nuance that you want to add to this? And then he was able to review the recipe that AI generated and say, no, actually I use a little more paprika here or something to that effect. And then you get the output with the AI generated answer plus Bobby Flay's expert review and information associated with that. That's kind of what Doximity AI is trying to do. They're generating an answer using AI, but then pinging the authors of the cited studies and saying, hey, this is the answer that was generated. Do you approve of this, or is this a hallucination? Now, as a physician, that gives you a lot more confidence in the responses that are provided. All right, so let me show you how this works in practice. When you type a clinical query, the AI generates a synthesis from peer-reviewed literature. Standard stuff so far, that's what we see across all of the clinical AI assistants. But here's where it gets different. The output that the AI generates as an answer then gets routed to specific subject matter experts. These are not random generalist reviewers. Doximity uses its network of physicians and their data to match the query to the physicians who actually authored the cited literature or who have documented clinical trial expertise with that exact pathology. So I've reviewed these as a peer check reviewer, and when I did, my name is prominently noted at the top saying, hey, this doctor reviewed this. And physicians around the country will of course say, well, who's this Balaram guy? And of course they can click on my name, see my credentials, see what other papers I've reviewed, and see if they agree or disagree with me. That's the benefit of having physicians on your platform with their credentials already listed so that you can understand that the peer check or expert commentary is coming from someone that you can trust. And then the expert commentary system takes this even further. When the AI synthesizes a complete paper, the original author of the paper is notified and given the opportunity to review the AI's interpretation of their own research. They check for clinical accuracy, verify the evidence strength, and flag any systemic biases. Think about how different that is from every other AI tool on the market. Because normally AI models just scrape published literature, strip away the author's nuanced intent, their study limitations, their clinical caveats, and reduce it to a summarized bullet point. Doximity brings those primary authors behind the curtain to verify the AI's representation of their own work. And here's why Doximity has a structural advantage that is very hard to replicate. 85% of US physicians are already on the Doximity platform. That means they can reliably ping these verified physicians to comment on the papers that they have written, as well as the physicians who are experts in the field to comment on the questions other doctors are asking about specific studies. That installed base is what Doximity is hoping is their moat. So two other quick points. Doximity realized that using AI for drug references is a concern given that you don't want to generate incorrect information on drug dosing by pulling it from various sources, even if they're medically related. So if you click on these little pill icons, the information is provided by a static drug reference that is curated and structured for accuracy. You wouldn't want drug dosing to be pulled from journal articles because they may be based on papers trying multiple different doses to find their efficacy. You want a grounded data set for this, and that's what Doximity did. For my academic colleagues, you have it really good. You have access to your university library and all the journals at your fingertips, and sometimes even a librarian who will find it for you. For non-academic physicians who do not have access to a university library system, getting your hands on a specific paper can be a real headache. So Doximity offering free access to over 2,000 journals for physicians, that's a genuinely physician-focused feature. There's nothing more frustrating than finding the exact journal article you need and then having to pay $50 for a single paper because it's behind a paywall. Those of you who have watched this channel before know I've been critical in some of my previous videos of AI companies monetizing the goodwill of physicians and scientists who publish their research for the good of patient care. For the last few years, AI companies have been scraping our research, our clinical trials, our peer-reviewed papers to train their models. And physicians, of course, have not seen a dime for that. Not an ounce of credit is usually given. Well, to their credit, Doximity reached out to me after seeing some of my criticisms and said, hey, we're trying to do something a little bit different here to benefit those who produce the research as well. So what if an artificial intelligence platform actually paid and recognized physicians who built its brain? That's the economic shift we need to be talking about in clinical AI. So Doximity's model addresses this head on. Physicians who engage as thought leaders on the platform, providing expert commentary, publishing their viewpoints, clarifying AI outputs, are frequently eligible for compensation. Yes, you can get paid for commenting and reviewing an AI answer that cites a paper you wrote. It is not my area of expertise to be able to pick a winner between all of these different tech companies. But I will state this. If you're rewarding the people who are doing the actual research, your ability to keep your model sustainable and to ensure the trust of the medical professionals is the way forward. So I do like the way that Doximity is kind of transitioning clinical AI from draining the well of medical knowledge to kind of replenishing it. For the amount of free work that physicians do to advance medicine for the betterment of patients, it's nice to see that maybe there's a component of compensation that should return to the scientists actually doing the work. So as I continue to review these products, I see kind of a broader picture starting to form. As some of these foundational AI models become increasingly commoditized, the value of the raw medical data set will decrease. But the value of the verified, accountable human expertise will continue to increase. It's one of the reasons I started this channel, right? There's so much information that gets thrown at you every single day. All of these AI-generated LinkedIn posts and AI-based medical articles can overwhelm a person. Sometimes you just need a person to say, hey, I do something similar to what you do. I think this is a good concept. I tried it, and here's what I think. Platforms that recognize this shift and build concrete mechanisms to compensate, highlight, and elevate the human experts who verify the data will go on to attract the highest caliber of medical professionals. Now, I would not be doing my job on this channel if I did not talk about the limitations associated with this platform. One of the things we can't ignore is some of the legal ramifications associated with products like this. For example, if you're providing your peer review of a AI-generated answer and you state that drug X is appropriate for condition Y, some physician uses that information and treats a patient, is there any liability held by the expert commentator or the peer check reviewer of this specific AI answer? Now, Doximity has structured peer checks so that the expert reviewers are not held personally or professionally liable for their contributions, but we have to acknowledge that this is a legal gray area, and we know that plaintiffs' attorneys can get quite creative when it comes to specific lawsuits. So it is going to be important to watch this going forward to ensure how this legal situation shakes out. The second limitation associated with the platform is the question of expertise itself. Although someone may be credentialed as an expert, their opinion may not always align with the general consensus of the medical community. We see this in the world today. So how do you determine who qualifies as an expert and how much weight should you give their commentary? Expertise is not necessarily monolithic. Two world-class oncologists can look at the same data and reach different treatment recommendations. And when I asked Doximity about this, they did report that they have some safeguards associated with this, including matching queries to the specific physicians who authored the cited literature or who have documented clinical trial experience. But the system is still dependent on human judgment. And the nice thing I will say about this is you do have the ability to click on the physician's name and get their credentials and also see what else they have published. That gives you a little bit more peace of mind in ensuring that they're an expert whose recommendation that you feel comfortable following. So when it comes down to it, physicians need to be careful not to develop an over-reliance on any single AI tool. Whether that's Doximity, Open Evidence, UpToDate, really the critical thinking at the bedside will always be the irreplaceable core of what we do. Pure algorithmic speed is impressive, but speed without human oversight creates risk. Traditional editorial consensus is safe, but then slow and expensive. So Doximity's Dox AI is attempting to find the middle path. The underlying philosophy is correct. The philosophy that clinical AI should serve physicians, compensate physicians, and be verified physicians, that's the right direction. So as a surgeon who is consistently reviewing medical technology, this is the closest I've seen any company come to getting the physician-AI relationship right. It's not about replacing us, it's about building tools to earn our trust. If you're a physician watching this and you have not explored Doximity's Clinical AI Assistant yet, I would encourage you to do so and let me know what you think. If you're a medical student or a resident, understand that the tools that you're choosing to rely on now will shape your clinical reasoning habits for your entire career. So make sure you choose tools that are making you a better thinker, not a lazier one. So if you found this breakdown useful, please hit that subscribe button. It genuinely helps the algorithm surface this content to other physicians who need to see it. And please feel free to drop a comment below. Are you using Dox AI, Open Evidence, or Up to Date? What are some of the pros and cons that you see with all the systems? Maybe you're using something else entirely that I can look into in the future. I'd really appreciate that. I want to hear what is working for you in your clinical workflow. If you enjoyed this video, you may like to check out my other video on Open Evidence, which we've talked about today, or a review of the entire Doximity platform, which you can check out over here. Thank you so much for watching. I know your time is valuable. Have a great day.